Welcome back to WJZ at 9, and in today's Wellness Wednesday, it's about a stomach bug, or is it something more?
Oh, wow. Well, Dr. Mona Gahunia, a specialist in infectious diseases with Kaiser Permanente, joins us this morning to tell us what we need to know about cyclospora outbreaks across the country. Doctor, we've been hearing this word. We know more about it than we ever cared to. So tell us what we need to know about this.
First off, Cyclospora is not a new parasite. It's been around for many, many decades, in fact. But you're hearing more about it now because of the current outbreaks that are primarily affecting 5 states, but certainly have been more widespread lately. It's more common to see in the spring and summer months when people are eating more fresh produce. So it is a parasite, and it can cause watery diarrhea most commonly, fatigue, loss of appetite. Those are the 3 most common symptoms that people experience.
I know a lot of people, you just listed some of the symptoms, but the words that people have been using to describe it is explosive diarrhea. Is it that far? What makes it different from a typical tummy ache? Is it really that big?
So it's not always explosive for everybody. I think what makes it different is the persistence of symptoms. So most diarrheal illnesses are viral, and they resolve on their own within a couple of days. So with this, the key is that if you're not feeling better after 2 to 3 days of having diarrhea, you should find out if there's something more going on. You would need a stool test to make the diagnosis. So it's really that this can be more persistent. In some people, it can be explosive, but that's not always the case. So I wouldn't, characterize it always in that way.
Okay.
Now, you mentioned that this has been around for a long time, but it's because of this outbreak that we're hearing so much about it. What is it about this current outbreak that makes it stand out?
Yeah, I think they're still trying to figure out the exact source, but it looks like it's imported lettuce, likely from Mexico. Oftentimes, these outbreaks are linked to imported produce because of the water and other things that are being used to wash the produce can be contaminated with the parasite. And then if it's not properly managed along the, food supply chain, that it can be introduced into our supply chain here. So the key is really important. The most important message is we're not saying don't eat fresh produce, but really pay attention to products that are recalled currently, and you can find out about those on the FDA and CDC websites. And second, make sure that you're thoroughly washing all fresh produce before eating it, especially anything with crevices or folds where it can hide out.
Yeah, so a lot of people say thoroughly wash. What does that process actually look like? Is it just mixing the vinegar and the baking soda, or is there something more that we need to do?
Yeah, you don't always, even water is enough. Like water, so physically washing the parasite will reduce the load of the parasite. It doesn't completely eliminate it, but it'll likely reduce the load enough so that it won't make you sick. But if you want to eliminate the parasite or kill it, then you have to cook it. And the right temperature is about 158 degrees Fahrenheit, 70 degrees Celsius. But most people aren't going to get super sick with this, so that's why we don't want people to worry too much. If you do have persistent symptoms, go ahead, contact your doctor, get tested. For people who are immunocompromised, those are the people that have to be more careful. If you're on chemotherapy or taking other medications that can affect your immune system, you're going to want to be more careful.
Well, Doctor, thank you so much for helping alleviate some of these concerns. There's been a lot of talk about this in recent weeks, so thank you for your insight.
You're welcome.
All right. That's Dr. Mona Gahunia.